Good afternoon, and thank you for joining us for today's webinar, Incorporating Gender-Affirming Care in Health Professions Curricula. Before we get into today's presentation, we have just a few housekeeping items to run through. Today's webinar will be recorded, and a copy along with the slides will be sent out to all registrants at the conclusion of the presentation. Attendees are in listen-only mode. However, if you'd like to chat with us or ask a question, you can do so on the right-hand side of your screen in the GoToWebinar control panel. If you're on social media, we invite you to connect with us by tweeting @Kognito or using the hashtag #CognitoWebinars to continue the conversation online. Finally, I'd like to now turn things over to today's moderator, Gurnek Singh, to get us started and to introduce today's presenters.
Thank you, Scott. We're very excited to have so many of you join us today to discuss transgender health and how we can help prepare providers to deliver gender-affirming care. With me today is Nathan Levitt, Director of LGBTQ and Gender Justice Learning at Yale School of Nursing. We'll have an opportunity to have a nice long conversation with Nathan, but wanted to just address a couple of key, why we're having this conversation today. Scott, if you could go to the next slide, please. So our trans and gender diverse members of our communities experience marginalization and discrimination throughout society, including healthcare settings. A lack of adequate training leaves many healthcare providers feeling unprepared to support and care for trans and gender diverse individuals, exacerbating health disparities. Compared to cisgender people, trans individuals face greater barriers to accessing care, experience an increased burden of disease with a significantly greater incidence of behavioral health issues, and disproportionately higher rates of suicide. The current climate and the proliferation of anti-transgender policies really demands our best efforts to combat these challenges and advocate on behalf of our transgender patients and neighbors. So if we look at the next slide, really gender-affirming care is compassionate care. And it builds on the growing emphasis on social determinants of health, right? So social determinants of health really refer to those conditions that represent inequities in our society, such as socioeconomic status or systemic and personal discrimination that can affect access to housing, food, education, employment, even physical safety, and of course, access to healthcare as well. Social determinants of health serve really as the academic basis for what we as healthcare providers and educators understand and believe deeply, which is that we treat the whole person, not a disease or a set of circumstances. We recognize there are many factors that contribute to an individual's overall health, and it's our responsibility to be attuned to them, and that also includes gender identity. So we're going to talk today about how we can represent gender identity in our overall approach to caring for all patients in the same caring and compassionate manner. So it is my privilege to be joined today by Nathan Levitt, as I mentioned, the Director of the LGBTQ and Gender Justice Learning at Yale School of Nursing. Nathan is going to talk with us today about the fundamental principles of gender-affirming care. And I have personally gotten the opportunity to get to know Nathan over the last few months as a key contributor to the development of a learning experience based on those fundamentals. We're excited to share more on that with you a little bit later. But now let's bring Nathan into the conversation. Hi, Nathan. And if you wouldn't mind, could you tell us a little bit about your work on LGBTQ health issues and how you've come to be a leader in that area?
Sure. Thank you so much. And thanks everyone for being here today. So I have been doing LGBT health work for about 20 years, started as a community organizer and educator within LGBT health clinics, and then went on to nursing school, to undergraduate and graduate nursing school, and became an educator and someone that helps faculty in nursing schools, in medical schools, in health professional schools, and clinicians within hospitals and health centers incorporate LGBT health into their curriculum, into their practice, training all levels from a front desk person to nurses to medical providers to make sure that clinicians and students feel comfortable with LGBT care. And so I've been doing this work for quite some time. I'm also a part of the trans community myself, so I know not only how to take care of the community as a nurse practitioner, but also what it's like to be someone in the community navigating healthcare. And my most recent position is teaching within the Yale School of Nursing. Before that, I did work on transgender surgery care, hormone care, and primary care. And I'm happy to be a part of this today.
Yeah, thank you for sharing that. And we're really glad to have you. It's been a pleasure getting to learn from you as well. I mean, you're obviously a very fantastic educator too. So let's start, at the very beginning. And maybe tell us, what is gender affirming care? What does that term represent? How should we think about it?
Sure. So gender affirming care is really treating the patient like a whole person, right? And making sure that you are affirming who they are. And the reason I love the term gender affirming is it is about really empowering the patient, your client, to feel more comfortable with themselves and to provide the care that is relevant to who they are. So caring for people across different genders. And there are many different definitions of transgender, but really you want to think about someone who identifies their gender differently than the sex that was assigned at birth, right? And that can happen at any age. So it can be as young as kids are able to talk, saying they don't feel like a girl, they don't feel like a boy, or it could be later on in life, 70s, 80s, and beyond. At any point in the continuum of age, someone can come out as transgender and feel like a different gender than when they were assigned at birth. So the care is not necessarily different than caring for other patients, but it's more about having the expertise, the awareness, the sensitive language of what this population faces within healthcare, using the right names and pronouns, and also knowing the clinical care around medical transition. So it's really affirming the gender that they are.
Thank you. And sometimes also I think the term care, maybe we think of in a narrow sense as just what we deliver when we're meeting in person with a patient. But really, I think care begins before we even interact with our patients. So how do we create an environment that is welcoming and gender affirming?
So that's a great question. Before you even see the patient, right? If you're a clinician, before you even see the patient, there's all these different barriers, different hoops they're jumping through, different experiences they have, whether it be the phone call they get to confirm an appointment where they might get called the wrong name or pronoun, or their gender specific information can be offensive or not appropriate for them, or they're coming into your health center, if you work in a health center or hospital, and they don't see any indication that this is going to be a sensitive place for a trans patient. That could be like brochures or things on the wall, to the forms that they have to fill out. When you have to fill out a form and it doesn't have anywhere to put that you identify as trans, anywhere to put anything about your sexual orientation or your sex assigned at birth, you're definitely going to assume that this is not going to be a sensitive place to go, right? So also dealing with electronic health records can be difficult. There's not always a space to put this information, but that can be really challenging too. So you could not have a space to put someone's chosen name or pronouns, and then they're going to get called the wrong name or pronoun in the waiting room or in other places of contact within your healthcare center. And so there are other ways to record that information. And so that's really important to kind of look into. Putting up signs, having information about trans health. There's lots of great information out there, but just know if your patient comes in and they don't see any of that, or they see forms that don't include them, they may not even go through with the medical appointment. If it's within a hospital, they may feel very alienated and isolated. They may not be able to leave, or they may not be their true selves, right? They might not talk about who they are because they don't see your facility or you as a clinician as someone that's safe to talk to.
Yeah, thank you. That's a really great point. Welcoming spaces and creating that openness right from the bat, so that when we actually get a chance to interact with those individuals, they're feeling like they're in a safe space and they can be honest. Which is obviously critical to providing the best possible care. So when we're talking with transgender individuals, gender diverse individuals, what are some important things to know about language and terminology and ways to use it to make them continue to represent yourself as welcoming?
Sure. So there are some ways to model that you are a informed and sensitive person to talk to. So for example, when I walk into a room with a patient, I will say, "My name is Nathan. I'll be your nurse practitioner today. I use he, him pronouns. What name and pronouns would you like to go by today?" Right? And so that's one way that you have modeled it yourself. It doesn't put as much pressure on them. It shows that you're going to be a trans-sensitive person to talk to. It also shares your own pronouns, which I think is a great thing for everyone to do, whether you're trans or not. And then you can also make sure that you've indicated that in your electronic health record. You can inform the rest of the staff. So if you're working with nurses, MAs, front desk staff, phlebotomists, wherever it might that patient might go to after or before they're with you, they're going to know that information. Sometimes people use sir and ma'am as a way to be polite, but it can be really offensive to trans and gender diverse individuals that don't identify with that gender. So asking people what name they use. If you don't know yet what pronoun or name they use, you can always have other ways of identifying, right? You can use a last name until you ask that information. Once you have their name, you can use the name itself. You can use the pronouns once you ask, and you can say things like the patient or the client until you have the information that you need. The other things that can be really gendered is the way we talk about people's bodies, right? So as a clinician, you will need to ask questions about a patient's body. The way that I do it is I ask all patients what words they use to describe their body parts. It's actually not just trans people that have different names for their body parts. So I was doing primary care with both trans and cisgender or non-transgender individuals, and everyone felt more comfortable with being able to use their own words to describe their body. So that could be something like, a transgender man doesn't identify with the word vagina. So when you need to talk about that body part, you can use their preferred language. Or a transgender woman might not identify with the word penis if they have that body part. So changing the language so that they feel more comfortable. Or things just like if someone has breasts and they don't identify with that, you can say chest. Really asking the patient, what they feel most comfortable with. And you're going to notice they're going to feel more comfortable. They're going to share information with you, whether it be about their sexual history, about what they're there for that day, about their partners. You'll just develop more trust with the patient, and you'll get the information you need.
And one question that comes to mind, obviously, is while we're supporting our transgender members of our community and we're incorporating these new ways to interact and introduce ourselves, what about those of our patients who aren't transgender? Do they potentially react differently, or what is a way that we can convey to them that we're treating everyone really the same with the most compassionate care we can give?
Yeah, that's a question I get a lot from clinicians, about, well, this isn't something I incorporate into my practice to ask, and what if non-transgender people, cisgender people feel offended by the question or don't understand the question? And so I've done primary care work for a long time in a facility that was a mix of non-trans, cisgender people and trans people. And so I asked every single person. And the way that I framed it was, we ask all of our patients this question, similar to how it's taken us a long time to feel more comfortable with asking questions about, let's say, domestic violence or other kind of maybe sensitive health issues. But we as clinicians are trained to ask them, right? So it's a similar way with this, right? So we ask all of our patients what name or pronouns they use in order to be respectful of our patients. And if they don't understand, you just give some more information that it is to help develop trust and comfort with your patients. And it's the trans patients in particular that you will notice just a sense of relief, a sense of, okay, I can be who I am here. The worst thing that happens is you have a non-trans or cisgender patient who asks questions about what you mean. But the reality is you do have to ask all patients, right? You can't just ask someone you think is trans. Certainly someone like myself, when I come in for care, people don't always know. I'd have to kind of share that information. So you really want to make sure that you're using it across all patients, and you can easily explain. We ask all patients these questions, and it helps if you have it on your forms as well. Not, that takes some work, but if you have it on your registration forms, on your intake forms, then that is going to be introduced already.
Yeah, that's really helpful, that level of perspective. And, kind of leads into my next question, which is, you mentioned sensitive topics. What's really the best way to approach personal or sensitive topics, knowing especially that, perhaps our transgender patients in particular may have had traumatic experiences, in healthcare settings as well, or with providers in the past?
So for sure, majority of your trans patients will have unfortunately had traumatic or discriminatory experiences within healthcare. If you think about how gendered healthcare is and how little knowledge there is, especially in medical schools, nursing schools, social work school, about trans issues, most providers, most clinicians will have not received information on this. So that means that, already they probably have had a bad experience with a medical provider. And it takes a lot for a trans patient to come in after having a previous negative experience, right? So be aware of anything, any procedures, any questions, any intake history and physicals that you need to do that could potentially be triggering, that could be traumatic. So really it's anything around gender. So as we talked about before, asking questions around body parts is important. explaining what you're going to do before you do it. You should do with all patients, but definitely with trans patients, especially when it comes to touch and body parts, explaining why you need information. So for example, I often get, and a lot of trans patients get, a lot of inappropriate questions that aren't related to their care, right? Clinicians might be just curious. So for example, I've come in for a cough and I've had questions about my genitalia, which there's no connection, right? So explain why you need the information, because as trans patients, we're really unfortunately used to clinicians asking us questions that are not appropriate. So you want to say why you need the information, clarify that you ask about this of all patients, reassure them that they're in control of their own healthcare. So often trans people aren't in control of their own bodies, of their own healthcare. And so here are some examples, right? To make sure I'm recommending the right exams and tests, can I ask you a few questions about your anatomy? It's a great way to frame why you need that information, and that it's not just a curious question, right? I ask all patients questions about their sexual history. Would it be okay if I ask you a few questions? So now you're also asking permission, and also shows that sexual history could be a really tough place for trans people to talk about themselves and their bodies. And then, as I was saying before, asking for consent before you touch, right? So is it okay for me to touch your arm as a part of the exam? So you're really showing why you need that information or why you need to do a certain procedure.
Yeah, I know, especially as a patient myself, being asked permission gives me a lot more control, makes me feel a lot more comfortable. Feels like, again, basic practice that is, makes sense for any of our patients, but obviously, especially those who have had, traumatic experiences with healthcare in the past.
Absolutely.
So, the other area obviously is, there's a lot to learn here. It's new for many people. So, how do we handle, maybe not having all the information, not using the right words, not asking all the right questions and making mistakes? What should we do when we encounter a situation like that?
Well, you will absolutely make mistakes. Everybody does, especially because we don't have electronic health records that are super inclusive of trans care. We don't always have the information we need going into it. We're very used to gendering things like women's healthcare, men's healthcare, things around, let's say, GYN visits, all the things that are very gendered. People do get caught up in that language that we've learned, right? So mistakes will happen. Maybe you don't have information on their chosen name or pronouns. The most important, it sounds simple, but the most important thing to do is to apologize. Don't brush it off. Don't assume maybe they didn't hear you or it didn't bother them. Trans people are have so many experiences where there are mistakes made and people don't apologize, or they don't really come forward and say, I realized I didn't use the right language. I'm so sorry for that. I'm going to make sure, make an action plan. So I'm going to make sure that this is in your chart, that I talk to the other people on the healthcare team to make sure that they know, the right name and pronoun to use. You might pick up body language that the patient feels very uncomfortable. So, making sure that you apologize, reassure that you're aware, that you see that someone is uncomfortable. It's also important not to be very defensive. So sometimes we've gotten, as trans patients, a very defensive and over apologetic response that actually is more about the clinician than it is about us, and it causes more attention that can be really uncomfortable. So you can, really just simply say, I'm sorry, make your action plan and move on. You can even say that you don't have a lot of experience in the area. As a trans patient, I would rather know that you maybe don't have as much experience, but that you're going to work on it, right? That you're going to approach colleagues to get more information. There's a lot of great resources out there that will be shared with you afterwards that you can always get, some more education on. And that honesty it goes a long way with your trans patients.
Yeah, honesty being the key there. I really appreciate that myself too. And so, I think we're all here because we do want to be able to provide gender affirming care. We want to be advocates for our transgender patients, but we know that the world out there is not all on board, not all trying their best to create welcoming environments. So how do we advocate for our transgender patients, when we need to refer them out of our care?
So that's a great question. Often you might be the best clinician, you're using the right language or helping your patient feel really comfortable, but then as always, we might need to refer out, right? And so I think one of the most important things to do is to make a little extra effort when you refer a trans patient out to make sure that the place you're referring them to is going to be sensitive as well. So making a phone call ahead to say, I need to send a trans patient over for wherever the referral site might be. do you have any experience with trans patients? Is your office trained? You know, are there forms that reflect their identity, so that you can also prep your patient, right? So that you're not just sending them out to a potentially traumatic experience that they may never go back to that referral site, and they may never come back to you afterwards too. And you can always connect with LGBT health centers in your area. There's a lot of great resources online that will be shared with you, where you can actually put in your zip code and it can find you an LGBT or trans-sensitive referral site or primary care site. So at least you know they've been vetted before you send, you know, someone into what could be a really dangerous and traumatic situation for them.
Yeah, thank you. And a couple of those resources, as Nathan mentioned, will be made available towards the end of the slides here and sent out to everyone in follow-up. So, you know, there's a lot to cover here. You know, we've made some really interesting points about how gender-affirming care really relates to compassionate care more broadly. So what are some practical strategies for training providers to deliver gender-affirming care? How do we introduce this to individuals who may not be familiar with gender diversity at all? And how do we help them understand and see the value in some of these key principles?
Yeah, so one of the most important ways is to really connect it to, you know, why we all come to this work, right? We come to this work to provide care for patients, to provide compassionate care to patients. And so often it's that they don't have that information, that is not incorporated into curriculum beforehand. So looking at gender affirming best practices, looking at, you know, some of the things that I went over before, how to integrate into your clinics, how to integrate into your care. Look at the guidelines we already learned about, like healthcare screenings, for example. Example here, trans men who have had top surgery may still be at risk for breast cancer, and they may not be aware of it. You know, when you're talking with the patient, you may say chest cancer if they feel more comfortable with it, but the screening that we know about as clinicians might need to be just tailored to this population. So transgender women who are on hormone replacement therapy or who have had gender-affirming surgery, such as a vaginoplasty, may still be at risk for prostate cancer because the prostate is still there. And we think about how hormones can affect different body parts too. So the content that we already know, the clinical care that we already know, just needs to be more inclusive and tailored to this population, right? So degendering some of this, so it's not women's healthcare and men's healthcare, but it's more what you have on your body, you have to get checked out, right? If you have it, check it. That's one of my favorite expressions. So it really reaches, you know, how you check. We know how to check different body parts out, but learn how to check them out when they're on hormones or when they've had different surgeries, and, you know, not using so much gendered language. So introducing that as compassionate care, holistic care, and role play is incredibly important, because you might learn this in school or learn this through this lecture today and still not feel the comfort in being able to ask those questions yourself. And so having the opportunity to really interact with systems so that you can practice those questions and you can practice what answers you might get back is going to help you so that you're not practicing on a trans patient, right? So that you have that information beforehand.
Yeah, and that kind of brings me to a question that I'm curious about is, you know, so at Kognito, we develop role play simulations, and you know, I'm curious, you know, why you decided to work with Kognito to develop this role play simulation on gender affirming care.
Well, I think it's so important in my experience, both as being a student, as being a clinician, as learning how to provide positive care and informed care. I found that the thing that was most helpful for me is this practice, is this role play, and as realistic as possible. And I think that that's what's been really great in working with Kognito, is that it does feel very realistic, right? It's like you have, you know, through animation, like you have a real patient there, and that you have these opportunities to try to do, let's say, a history and physical, you know, through this, where you're going to be asking questions and you can get the responses right away, right? And you can see, oh, I really messed up with some of that language, or I can see this isn't going in the right direction, and get some feedback afterwards, like this is how I could have done it differently. And so I think those opportunities where students or practicing clinicians can really practice in the most realistic way that's not harming trans patients, right? That's not traumatizing trans patients. It really helps with the learning. It helps more than, let's say, just, you know, words on a screen. It helps you to really think of, how did I respond to that? How could I have done that differently? And it will really challenge you and help with learning.
Yeah, thank you for that. And so, you know, with that, let's take a look at what we've had an opportunity to develop together. So, we partnered with Nathan and subject matter experts in transgender health, motivational interviewing, and chronic disease management to create our gender affirming care course that will introduce healthcare providers to these topics in a dynamic learning experience. In addition to the gender affirming care techniques that we've just been talking about, learners will also have the opportunity to develop their relationship-centered communication skills by engaging with our virtual patient, who is Nikki. So Nikki, if we look on the next slide, has had some bad experiences in healthcare previously, and in general has a difficult time trusting and being open. She's coming in today as a follow-up from her last visit, where she started several medications for hypertension, as well as smoking cessation meds. But she hasn't been taking them, and she has no intention of quitting smoking or discussing it at this visit. So our learner's goal is to motivate Nikki to take her treatment seriously and commit to taking her meds as prescribed. But learners will have to overcome her distrust and uncover any underlying issues that may be contributing to her lack of motivation. During the course of the conversation, learners will have to utilize gender-affirming care techniques and motivational interviewing to uncover social determinants for Nikki's current state of health and be mindful of behavioral health issues that may also be impacting Nikki's health. So through careful conversation, the learner can uncover warning signs of depression and recognize that addressing this may be the best way to address her other chronic disease issues. Nikki's going to be open potentially to mental health support and screening if she knows
I think we might have lost Gurnek there for a second. Nathan, you don't see Gurnek moving on your screen, right?
I know, it just looks frozen.
Okay, well, we'll wait for Gurnek to get back on. Nathan, if you could just talk a little bit about some of the considerations that went into designing Nikki and really how Nikki is a very representative virtual human.
Sure. So what I think is really well laid out here is that you get the opportunity to look at the social determinants of health, as Gurnek was talking about. So you have a development of who Nikki is, that she's an older trans woman, or 52 is not that old, that she's had this previous experience of distrusting healthcare providers. She's a smoker and has hypertension, so it allows the learners to really be navigating that and knowing that you're trying to work with your patient to quit smoking. There's a lot of different interactions there because, if you know that you have some more information that this patient is on estrogen, is on hormones, you want to really be navigating all of that. And it has here what your goals are going to be. So you want to listen to her concerns, you want to support her, and you also want to think about smoking and healthcare and adherence with possible mental health issues. And those are all things that you would do with all patients, but you want to really be thinking about how to do it in the most trans-sensitive way. So there's a lot of different factors involved there. And I helped the amazing team to kind of look at how is this realistic in the care that I've provided to the trans population. Being a part of the trans population, it felt really relevant to who a trans patient might be and what they might be navigating within this experience.
Yeah, thank you, Nathan. I appreciate that. I couldn't have done it better myself while I'm dealing with technical issues. But yeah, I mean, just to extend on that point, at the core of development of these types of scenarios is really engaging with those experts in the field. So that's why it's been such a great experience working with Nathan, because we've been able to incorporate not just the fundamental principles, but realistic exchanges, dialogue that can only come from practical experience, having navigated these conversations for many years successfully. So we've built that knowledge, that anecdotal evidence from practical experience, and combined it with best practices and the evidence base to create a truly immersive and realistic experience. And another important thing to note is we have really talented actors who have recorded the audio for us. And Nikki was recorded by really great transgender actress Jessica Hogan, who brought a lot of life, a lot of realism to the role as well. So you'll get the opportunity in just a moment here to hear and experience what the conversation sounds like. But another really important point to make is we preface the actual role play experience with a series of didactic instruction that reviews those fundamental concepts of motivational interviewing, social determinants of health, including gender-affirming care, as well as the signs and symptoms of common behavioral health issues, to prepare learners for their interaction with Nikki. So while the core focus here is being able to execute gender-affirming care techniques, we wanted to provide it in a realistic context, in a typical scenario that students may encounter, just navigating a patient who's in for a regular follow-up visit, who's been prescribed medication, and is just struggling to adhere to that plan. We have to understand why. We have to get to the root cause in order to effectively help this individual improve their overall health. So without further ado, let's take a look at the simulation experience. So my colleague Scott is going to be pulling up the simulation on screen. And one note, technical issues being what they are, we are transmitting this via the internet through this a virtual meeting. So there's probably going to be a little bit of lag just between what you see on screen and the audio coming through. Rest assured, there's no delay when you play these simulations live. So bear with us just in dealing with the meeting software. But so what you're seeing on screen right now is the menu that learners will arrive at when they open up the course. It provides a brief description of what you're going to encounter, and then the learners can begin by navigating the individual didactic components. So we've included the times here because we know time is very valuable. Students are very sensitive to how much time they have to dedicate to a specific experience. So once they navigate about 20 minutes or so of didactic content, they're ready to talk to Nikki. The Nikki conversation itself is meant to be about 10 minutes, but again, students can take as long as they want. They can navigate many different pathways, as you'll see in a second, and they may end up spending a significant more amount of time here to really get a sense for how to utilize these techniques and skills, how to navigate these conversations, and how to incorporate what you're learning into your own real-life practice. So we'll just go ahead and jump into conversation with Nikki, and we'll get a chance to play through a few decision points to see all of the different ways in which the simulation provides feedback to our learners as they go. So we have built a standard and a more advanced version for learners to practice. The standard version starts with the most core skills, gender-affirming techniques and motivational interviewing techniques. Advanced will require a few more advanced techniques and will provide less guidance and a few more additional barriers. So we not only change what the learner is expected to demonstrate, we also change some factors of the patient persona, making Nikki a little bit less willing to come forward with her primary issues, a little bit less motivated to address her behavior change. So we'll just go ahead and play through a few of the standard dialogue notes to give everybody a sense of the experience. So here we are, we're in the exam room. We're sitting across from Nikki. We're represented by the provider avatar here on the left, who's got their back facing us. And we're going to navigate the experience by clicking on the talk menu. So if we click on the talk menu, we're going to see a tactic pop up, and within that tactic will be a variety of different dialogue options. Those dialogue options are what we choose to say to Nikki, and we can observe how that choice impacts Nikki, both in terms of her actual response to our dialogue, as well as a few of the additional feedback mechanisms that are going to pop up. So I'm going to go ahead and ask a question here, and I'm going to go right ahead and address the issue, which is on your chart. I saw Nicholas, but what I'm hearing is that actually there's a different name that I should call you by. So let's see if I choose that option, how this conversation is going to play out.
Your chart says you're Nicholas, but I've heard you referred to as Nikki. Is that right?
Please refer to me as Nikki. I use she, her pronouns.
But my form says Nicholas.
I'm trans. My name used to be Nicholas. Now it's Nikki. Can we just move on?
Oh, okay.
So we are right away getting an opportunity to expand our learning on this particular area. So throughout the simulation, this dialog box will appear that allows the student to select additional resources that they want to add to their portfolio that they could reference after going through the simulation. So if they felt that they didn't understand why they didn't make the best choice, they want to learn more about names and how to deal with the variance in ID forms, they can pick any of these items, click submit, and it will be available for them after they complete the experience to dive into further. So I don't really like how that went. I sensed a little bit of defensiveness from Nikki when I chose that approach. So I'm actually going to go ahead and undo that selection, and I'm going to try a different approach and see how that alters the interaction with Nikki as we go forward. So we can just click on the undo button. It'll take us back to the previous decision point, and we'll have the opportunity to try something new. So if I go back into that talk menu and I go back to ask a question, I'll see that the option that I just selected was grayed out. So it just reminds me where I've been. And what I'd prefer to do is actually introduce myself as Clark and use my pronouns to create an opening for me to ask Nikki how I should refer to them.
Hi, I'm Clark. I use he, him pronouns. How would you like me to refer to you today?
I know my insurance card says Nicholas, but I'm Nikki and my pronouns are she, her.
I'll be sure to update your chart with that information.
That'd be great. Thanks.
And how would you describe your gender identity?
I'm a trans woman.
Okay, thanks for sharing that.
So now we see a new feature popping up here at the bottom. That's our performance meter. If we click on it, it will just help us understand, when we're making appropriate decisions, when we're making decisions that are creating distance or alienating our patient, and it will help us kind of formulate what's going to be successful and what's not going to be successful over time. So this will move up, this will move down as we continue to make decisions throughout the course of the experience. So I'm going to go ahead and make one more decision before we take a look at some of the other features. So if I go back to the talk menu, and now I get an opportunity to dive into the question of the day, which is, how are we doing with our medication experience? So I'm going to ask, everything going okay with the new medication, and see how that particular option affects the conversation.
Everything going okay with the new medication?
It's okay, I guess.
So not a lot of information coming back, but we do see a couple of new key interface elements. So if I click on the bouncing button at the bottom, this is my virtual coach, and the virtual coach is going to provide me with best practices feedback that helps me understand why a decision I made was good or why a decision I made wasn't so good. So in this case, right, we asked a closed-ended question, and that indicated to Nikki that her answer should be brief and short. So the better way to approach it is to try to use an open-ended question. And again, in the didactic series, we've gone over what is closed-ended question, what is open-ended question. So we've given our students the opportunity to make a decision based on what they've learned and see how well they've retained that information. Another important feedback mechanism you'll see is the thought bubble that pops up over Nikki's head. So periodically throughout the conversation, we want our learners to attenuate to the thought processes of our patients, things that are in the back of their mind. And again, this is based on a number of interviews with members of the community to understand what their perspective is when they're in these particular visits. So we want to make sure we bring that to the attention of our learners so they can better understand what the thought process is. So if we click on that, we'll see what Nikki's been thinking about this.
I mean, I haven't really been taking them.
So more information could have been had, but we asked a closed-ended question, so we didn't actually get to all of that information. So the conversation continues. There are many opportunities for students to demonstrate those particular skills. And when they get to the end of the conversation, they can receive feedback through a dashboard. So we'll jump back to the menu and just show you the dashboard really quickly to get a sense of the types of input and feedback that we're providing students. So this is a formative experience. The goal is really to practice. So we're not providing a qualitative evaluation, but what we are is going to be providing qualitative, we're not providing quantitative evaluation, we are providing qualitative feedback. So we hadn't completed this conversation, so our results are incomplete. We haven't done so well thus far, so we have a bunch of check minuses, but as I complete the conversation, this will populate with specific feedback based on the decisions I've made. So we'll be analyzing the number of opportunities you had to use a specific conversation skill and the number of times that you actually did it successfully, providing you with a generic categorical return on that, and then directive feedback about when and where and how you could have improved your interaction with Nikki. So that's just to exemplify a couple of the key features. I know we're almost out of time. We do want to leave an opportunity for some questions. So we'll return to the slides really quickly. One additional item we wanted to point out is beyond the simulation, we are also providing a broader course curriculum that's laid out in the accompanying facilitator guide. So this facilitator guide, which is the faculty guide, the lesson plan associated with the simulation, provides pre-brief and debrief exercises along with additional role plays that can be run during live facilitation sessions. So the facilitator guide really describes how the additional course content with the simulation can be integrated into a broader curriculum and add, approximately 4 hours and up of additional clinical training time that's available. So, with that, we want to leave time for any additional questions our audience has about gender-affirming care, the techniques that we've shared with you today, the simulation that's being made available starting next week, or any of these additional resources where you can find more on transgender health and gender-affirming care. So I believe, Scott, if there are questions, they can be typed into the chat. Is that right?
Yes, absolutely. If you guys have questions for our presenters today, you guys can ask those in the question panel on the right-hand side of the screen. We have a couple coming in so far. The first one is, how do we explain to trans patients that we must document their birth sex for medical reasons? Example, prostate exams.
So that's a great question. And it actually, really is framing it like why you need that information. And so the answer is sort of in there, right? You want to say why you need that information. I'll need to ask you some questions about what sex you are assigned at birth. So that's a better words to use or phrase to use, sex assigned at birth, and then the gender identity or gender they identify now. So when first the trans patient is asked that question, they do want to know why you need it, right? Why do you need that information? If they're not so experienced in the healthcare world, they might not know what might be related or not related. So you can say, as a medical provider, I will need to ask your sex assigned at birth. You're also going to need other information, right? Just knowing their sex assigned at birth might not tell you everything you need to know. You also need to know if they've had any gender affirming surgeries, right? Because if, let's say, they're assigned male at birth, you might assume that they have a penis, but perhaps they had a vaginoplasty. So that person will still have a prostate, but will have a vagina, right? So you want to explain what you need that information for in the most sensitive way possible. But if you've prefaced your visit by introducing yourself and your pronouns, asking them their name and their pronouns, asking about gender affirming surgeries, asking about sex assigned at birth and gender identity, then hopefully that patient's going to feel more comfortable when you need to ask those questions, and also using language that they most identify with.
Next question would be, how should we ask if they have had any sexual affirming surgery?
Yeah, so you can ask, just like you ask usually clinicians ask all patients what surgeries they've had. I usually say, what is your surgical history? Have you had any surgeries? Have you had any gender affirming surgeries? I add that piece on because I know as myself, if a clinician asks me, have you had any surgeries? if I don't feel comfortable with that clinician, if I don't have any awareness that they are sensitive around this, I may not share a surgery I've had that's related to being trans to a gender affirming surgery. But that term, gender affirming surgery, already shows yourself as a clinician that knows the language, that understands what that means. And so that patient's going to feel like they can answer that question because they can see that you're someone that is well equipped in that language and that you might have some clinical knowledge and sensitivity knowledge around that.
Great, good answer. Let's see. Gurnek, this might be a good question for you. I'm interested in how this can be obtained and applied from my didactic and clinical courses.
Yeah, so if you reach out to us at the email that's listed here, clinical.training@cognito.com, we have a team of client success experts who can help you understand the best way to incorporate this type of training into your curriculum, all the different reporting and data capture elements, as well as the systems integrations that's required to allow students to access these web-based simulations. So there's a number of different ways. Our team makes it really simple, but it's very flexible to essentially meet the needs of your particular class and your specific students. So please do reach out to us at this email, clinical.training@cognito.com. We'd be happy to talk to you in more length.
Great, thank you. And I think that's all we've got for questions, and I want to be respectful of everyone's time. We are at the mark. So I want to thank today's presenters, Nathan and Gurnek. Give them just a minute to give some closing remarks, and thank you all very much. Over to you guys.
Yeah, I want to thank I wanted to thank you, Nathan, for again sharing your expertise and really bringing a lot of excellent perspective to this really important topic, and breaking it down in a way that's so so relatable to how we want to care for patients in general. So thank you very much for that.
Thanks so much, and I'm happy to be here. Thanks to Kognito for recognizing this as an important, essential clinical care and information and exercise for clinicians and for students. And thank you all for being here and for asking questions. This is such an important step in providing care for the community, and it'll really go a long way to helping us take care of ourselves. And for a lot of trans patients, this is life-saving care. So I really appreciate you learning this and hopefully teaching it as well to your colleagues and students.
Thank you all so much.